Hi, everybody. I'm Jeff Milton from Bloomington, Indiana, here in the United States. And
I'm Bob Sinclair from North Bay, Ontario, Canada, and I want to say what an honor it is to be here today.
yeah, the same. And also very happy to be giving this talk from the comfort of my own home. So I don't have any concerns about catching COVID at a conference. So today, what we're going to talk about is pandemics as a social phenomena. Now, diseases, on one hand, are medical or biological phenomena, but pandemics are a product in one way or another of social behavior. And so, what we've done in our research is look at how different patterns of social behavior during pandemics lead to different outcomes in terms of things like infections and deaths from COVID. And in turn, what sorts of factors produce those differences in behavior. So, without further ado, let me just start the presentation here. So pandemics are social phenomena, and we look at how culture as well as political ideology produce patterns of social behavior, both government policies and individual behaviors that influence outcomes as far as the COVID-19 pandemic is concerned. Specifically, we looked at infection rates and death rates. First, cross-culturally in different countries, and secondly, within countries, looking at ideological differences within countries and how those affected things. So, one dimension of culture that Geert Hofstede looked at in his seminal research back in the 70s and 1980 was what he called collectivism versus individualism. And that's a dimension of cultures wherein folks in collectivist countries or collectivist cultures put the needs of society first, ahead of their own individual needs and desires. And in contrast to that, those in individualistic countries, such as the U.S. and Canada, where Bob and I are from, place their own needs and desires ahead of those of society. So it's all about the individual's goals and desires to a greater extent than is the case in collectivist countries. So here you see a scene from somewhat early on in the pandemic in my home country, the United States. This was in Sturgis, South Dakota in August of 2020 during the 80th anniversary of the Sturgis motorcycle rally, where what happened was right in the middle of the pandemic with COVID restrictions still in place in most parts of the U.S. Kids were not in school in person. Many businesses were closed. There were mask mandates in a lot of places, etc. But there in South Dakota, and to an extent in other parts of the country too, people were gathering en masse indoors without masks, and approximately 200,000 people came to this convention or rally in this dinky little town in South Dakota. I forget how big it is, but it's very small. And they had a massive outbreak. And quite a contrasting scene right here is from a collectivist culture, Singapore, where, as you can see, everybody in the picture is wearing a mask. And granted, there were also mask mandates in public transit in many other countries, including the United States, but not everybody wears a mask even then, as both Bob and I can attest. So we can draw a distinction between behavioral interventions and medical interventions to try and influence pandemic outcomes. And medical interventions certainly are very important. For example, vaccines have been demonstrated in dozens of studies to reduce the likelihood of infection as well as severe disease, death, etc. And but medical interventions, impact the outcomes of individuals, and they may or may not play a role in affecting what happens with a pandemic, depending on exactly what they do. So, for example, a vaccine that had a very high rate of infection prevention would obviously influence the pandemic, the spread of the disease, whereas a vaccine that merely prevented serious illness and didn't do so much with infection prevention would not. But behavioral interventions, have more impact on pandemic outcomes than do medical interventions, despite the importance of the latter. So, things like wearing a mask in public indoor settings, physical distancing, hand washing, lockdowns, as well as adherence to them, and also, willingness to be vaccinated is another behavioral. It's another form of behavior that's important. So, in our early research, what we did was we looked at the relationship between culture and COVID outcomes, specifically infection per million and death per million rates across, I believe it was about 130 countries, something like that.
It was almost every country in the world.
Yeah, minus
as close as we
could that we
get.
couldn't find data to, but we had an awful lot. So the overall finding was that collectivist countries had lower infection and death rates. So you can see here, we gather data for infection rates at various times in 2020 and 2021. And so right from the get-go, as you can see there, infection rates in individualistic countries, I stands for individualistic, and these are infection per million rates, were much, much higher than in collectivist countries. And that pattern continues over time, where although the ratio is quite lopsided later on, because the pandemic, the virus spread throughout the world. But the absolute difference between our group of individualistic countries, of which we had 31, and our group of collectivist countries, 109, so that's 140 countries actually, it grew bigger over time. So there was massive interaction between collectivism versus individualism and time. And all of our effects had very large effect sizes. And you see the same pattern for death per million rates. Starts out extremely low in collectivist countries, very high in individualistic countries. And the absolute difference between them continues to grow as we move to later and later dates. And it's important to note that most of these individualistic countries are wealthier countries, and most of the collectivist countries are not very well off, and don't necessarily have as good healthcare systems as the individualistic countries. So that's quite striking that culture has this effect, despite that difference that would work in the other direction. And the other thing I'll note is that when we looked at age and other factors, which collectivist countries typically are much younger in terms of their average age, meaning less likely to die from COVID, that didn't explain the differences. Our effects barely changed when we
nor did population density.
Yeah, not population density or anything else that we looked at as a covariate. Well, where do these differences come from? Well, we found that collectivist countries, on average, implemented mask mandates much sooner than individualistic countries. They implemented, the set of measures that we colloquially refer to as lockdowns much sooner, and they were much stricter when they were implemented in a lot of cases. And yeah, in individualistic countries, you saw a lot of people getting upset about mask mandates and social distancing requirements and so forth. So we found that there were a lot of public protests against masks and lockdowns, and later there were also against vaccine mandates in individualistic countries.
Here for a second too, because this will come up later, and there's no point in me reiterating it later. This relates to Brem's psychological reactance theory, where people feel their freedom threatened, and what they try to do is re-exert their freedom, and they value the threatened freedom more so than they did prior to the threat. Now, it's been shown that you get less reactance in collectivist cultures than you do in individualistic cultures.
Right, because in individualistic countries, individual freedom to do whatever the heck you want is much more highly valued. Also you find less reactance, research has shown, in among more conservative, politically conservative people than among politically less conservative or more liberal people within individualistic countries.
I think you flip-flop that. More conservative, more reactance.
Yeah, I thought that's what I said. Okay. And other research on collectivism and individualism besides ours has surveyed people's rates of mask wearing in different cultures, and found that in collectivist countries there's a higher rate of wearing masks, reported mask wearing. We also found that although overall there were not overall differences in vaccination rates among countries that seemed to have sufficient access to vaccines between collectivist and individualistic countries, so far our data are indicating that collectivist countries' rate of vaccine uptake was more rapid than individualistic countries. So they took less time to reach a high population vaccination rate. So they're less hesitant to get vaccinated. So in other work that we've done, we have looked at differences in pandemic behavior and outcomes as a function of political ideology. Behavior here referring, and also in the case of the collectivism versus individualism studies, referring to both government policy and individual conduct. So, our working hypothesis was that people with more liberal ideologies would, although still within the framework of an individualistic country, be less extremely individualistic, and accordingly less resistant to things like wearing a mask and so forth, than people who are more conservatively oriented. And the same's true for government officials. More conservative governments tend to pursue less stringent policies to try and contain COVID. So that's what we looked at. And so I'll turn it over to Bob to go through our data on Canada.
Okay, and in study one in Canada, we looked at various dependent variables But one of the things that was quite striking is that infection per million and death per million rates in conservative-led provinces were substantially higher than in provinces that were led by other governments, and that these differences increased over time. So this is our infection per million rate data, and it's got the dates there. This interruption in the time series was a vain attempt on our part to look at the effects of vaccination rates. The problem was there wasn't enough vaccine uptake, and so during the time period that we used as the interruption, the time series. But as you can see, this is a whopping interaction in terms of infections per million. It accounts for about 50% of the variance.
Yeah. So as you can see, just as with the collectivism versus individualism data, right off the bat, the conservative provinces in Canada had much higher infection rates than the other provinces with other types of governments. And by the way, we were defining conservatism versus non-conservatism in terms of which political party was governing in a given province or territory at the beginning of our data collection. So as you can see, the difference in absolute terms grows and grows over time.
And we get the same effect on deaths per million, and again, it accounts for about 50% of the variance. The conservatism by time interaction with much higher death rates in the conservative provinces relative to the other provinces and territories, and this increases substantially over time. We also found that conservative provinces had higher infection per million and death per million rates in long-term care facilities. Conservative provinces had more business insolvencies. And this is an interesting point because in the conservative provinces, one of the things that they did was they closed small businesses but left big box stores open when there's really no empirical evidence to suggest that you're more likely to get COVID in a small business that follows the rules than a big box store that follows the rules. So essentially, they help destroy the economy. Conservative provinces took longer to introduce mask mandates. They allowed more people at religious gatherings and took longer to introduce interprovincial travel bans, or else they had none. There were more protests, so this reactance kind of effect, against mask mandates, lockdowns, and distancing in conservative provinces. The population of conservative provinces were less likely to have at least one dose of vaccine, and conservative provinces dropped their mask mandates earlier than did other provinces and territories.
Yeah, and this tendency to drop mask mandates has been true in individualistic countries throughout the world over the past few months. But our finding was that although it took place throughout Canada, except in certain settings, such as hospitals, it happened sooner in the conservative provinces. Okay, the second study in these data took place here in the United States, or we used data from the United States, and basically the same sorts of patterns. The nice thing about collecting data in the United States is that you have 51 data points, the 50 U.S. states and the District of Columbia, instead of just 13 as we had in the Canadian data. But same pattern for infections and deaths. We found a much higher infection per million and death per million rate in conservative Trump supporting states than more liberal Biden supporting states. And basically what we did to categorize states or DC as conservative or more liberal was we simply looked at the median percentage of voting for Donald Trump and split them down the middle. So I think it was approximately 49% and up voting for Trump went into the conservative category. And as in the Canadian study, the differences between the conservative and non-conservative U.S. states increased over time. So, here are the data from this. Now, there's one peculiar thing about how COVID hit the United States. It wasn't true of Canada, and I'm not sure about other countries, but the United States is a big country, and some areas of the United States, such as New York City or Seattle and so forth, have a lot more international traffic than other parts of the country, and so those were the places that got hit first by waves of COVID infections. So our first data there are from October, which is well after that happened, but early in the pandemic, you had states such as New York, which is a state that voted very little for Donald Trump and very heavily for Joe Biden, getting hit much harder. So they had, somewhat higher infection rates and much higher. And by the way, the infection rate data early in the pandemic, like in the first couple of months of the pandemic, were tainted by the fact that there weren't enough tests available. Deaths, it's much easier to confirm. But so in any case, we had a pattern where the infection and death rates, increased much more rapidly in the Trump states than the Biden states, even though early on in the pandemic, as you can see there, the death rate was actually much higher, death per million rate, in the Biden states. And then over time, the Trump states catch up and then surpass their Biden states. So by the final day of data collection, February 15th, 2022, there was a significant difference in the other direction where the Trump states had a much higher death rate. For infection rates, it's always the Trump states in the lead because, frankly, neither the Trump nor the Biden states were doing a very good job of testing people who had COVID early on in the pandemic. So, why did that happen? There are a number of factors that we looked at that probably played a role. And so one thing that was true once the vaccine campaign got rolling is that there was much more rapid and higher uptake of vaccines in the Trump states, lower in the Trump states than in the Biden states. Okay, never mind. I don't have a table for that. That's for the vaccination rates. So in any case, Trump states had lower vaccination rates, and in turn, states with lower vaccination rates had higher infection per million and death per million rates. Particularly for deaths, the states that had high vaccination rates, had significantly lower death rates for all dates, but especially as time went on. But of course, as I said, other than that first wave of the pandemic, which hit different parts of the U.S. unevenly, after that, there were other factors, prior to vaccinations beginning that were very different between the different states. So just as in Canada, mask wearing was a big difference between the more conservative and more liberal states. So Biden states where Biden got a higher percentage of the vote, implemented mask mandates sooner and kept them in place for longer than Trump states. And in fact, 8 states where Trump got a big vote never implemented statewide mask mandates. Mandate length and timing in turn were related to infection per million and death per million rates. So states that implemented mask mandates sooner and kept them in place for longer had lower infection and death rates, particularly infection rates. And we also looked at lockdown type policies across states and found that Biden states implemented closures of non-frontline businesses and stay-at-home orders for longer periods of time than Trump states. 7 Trump states never did issue stay-at-home orders. And in addition, as of September 2020, Trump states were far more likely to have in-person than virtual schooling, and the reverse was true for Biden states. And one finding that I forgot to put on the slide is that there were similar differences in terms of school mask mandates, just as there were for statewide mask mandates. So Biden states were more likely to mandate masks in schools over a larger proportion of school districts. And in fact, there were some Trump states where the governors would actually try to prevent local school districts from implementing mask mandates. So quite striking differences between states in their COVID policies as a function of political ideology and their outcomes. As I said, most parts of the world have now dropped mask mandates and most other COVID infection prevention measures and have adopted a vaccine-only policy of trying to prevent COVID outbreaks, which particularly now that we have immune evasive variants on the loose, don't tend to work so well. So you have the paradoxical situation of countries like New Zealand and Australia, which prior to even having vaccination rates, had very low COVID infection and death rates. I think New Zealand had something like 30 people die of COVID over the first year and a half of the pandemic, and they've had like 1,000 since then when they've had a high vaccination rate because they have largely dropped everything else that was keeping their infection rates low.
So these behavioral interventions are extremely important, and forgetting about them is problematic.
Yeah, and unfortunately, hate to break it to you at this convention of many medical professionals, but even doctors in individualistic cultures have decided to go to conferences and ditch their masks. And there have been a number of reports of people getting COVID at these conferences. And here's what the virus thought about all this. This is kind of a parody account on Twitter with somebody posing as the virus. I had an incredible time with your Emory EM family too. Thanks for ditching the mask so I could join you. Look forward to meeting all your patients when you return home too. So, what can we conclude from all this? Bob, you want to say a few things?
More conservative provinces and states had worse pandemic responses and outcomes than more left-leaning ones. Individualistic countries had worse pandemic responses and outcomes than collective ones did. Although vaccines have had a strong influence on COVID infection and severe illness rates, behavioral interventions have a far stronger influence on pandemic outcomes. Countries that have shifted to vaccine only pandemic responses. For example, Portugal and Australia are having record outbreaks of Omicron BA.5 right now. And we argue that a comprehensive approach must be used in order to control pandemics.
Yeah, and granted, it's possible that a vaccine that is very effective against the current variants will come along, and maybe that'll save us. Particularly if somebody can develop a nasal vaccine, nasally administered vaccine that prevents infection right at the source. Maybe that's our ticket out, because unfortunately, we all know that culture is not going to change. Culture is what it is. And so those differences that we've talked about in behavior will likely continue. And same with differences between different regions that vary in terms of their political outlook. Certainly, we did see early on in the pandemic that as the situation got so drastic, there's just death all over the place from COVID, and there are no vaccines at that point, and we don't really know how to treat COVID very well yet. And that prompted even individualistic countries to implement pretty strict measures to try and limit the spread. So most places had mask mandates. For example, every state in the United States closed schools for some period of time, for example. But over time, people kind of revert back to their natural inclinations. So you had the examples of individualistic countries like Australia and New Zealand doing very, very well. Very much the exception to the rule among individualistic countries early on in the pandemic. But as time wore on, they seemed to kind of revert back to their individualistic inclinations and dropped most pandemic control measures.
Whereas, as I have said in the past, both New Zealand and Australia managed to make a sow zero out of a silk purse.
Exactly. They really did. And that's not to say that there are not collectivist countries that have done a poor job of handling the pandemic, particularly countries with very sort of right-wing governments like Brazil. Never did manage to reach the or they screwed up their chances of being silk purses and were Salazar's right from the get-go. But even there, Brazilians did not have an anti-vax movement. They very eagerly took up vaccines, and they wore masks and so forth. But it kind of wasn't enough to overcome the nature of their government. But generally speaking, we found a pretty strong difference between collectivist and individualist countries, and within individualistic countries, which overall did much worse in the vast majority of cases than collectivist countries. Differences in political ideology played a role. But we have to keep pushing for better policies. At least the way things look now. Vaccines, as great as they are in terms of limiting severe illness, are not going to be enough to control the pandemic. We need everybody to wear a mask in public indoor settings. We need better ventilation. We need a lot of policy changes that haven't happened yet, particularly in individualistic countries.
Thank you very much. I enjoyed being here.
Thanks, everybody.
Thank you.